You know that feeling, right? You pull a muscle, you twist something, and you get that instant, sharp pain. And what's the first thing we all do? We reach for a painkiller. But what if I told you that our whole way of thinking about that pain is changing, like right now? Today, we're going to dig into the new science of muscle pain and uncover a pretty serious risk hiding in a common prescription.
So let's just start with the big question. What is the best way to treat that pulled muscle or that sprained ankle? For years and years, the answer was simple. Pop a pill. Well, it turns out that answer isn't so simple anymore.
Yep, the answer has totally changed. We're getting off that rocky road of just relying on pills. I'm going to show you exactly why the old advice is on its way out, what the new rules are, and most importantly, what it all means for you.
First off, let's just establish how incredibly common this is. I mean, we're talking about a kind of pain that pretty much everyone has felt. It doesn't matter if you're a pro athlete or just someone who, slept funny on the couch. We've all been there.
All right, let's put some numbers on this. Get this, in a single year, 2010, there were 65 million, that's million with an M, doctor visits for these kinds of injuries in the US alone. That is a staggering number of people looking for help with strains and sprains. It's huge.
And if you think that number was gig, look at the price tag. Treating all those injuries cost over $176 billion. So yeah, this is not some minor thing. It's a massive public health issue, and that's exactly why figuring out the right way to treat it is so critical. And that brings us to the main event, the new rules for pain. This is a big deal. Two of the most important medical groups in the country, the American College of Physicians and the American Academy of Family Physicians, just put out new guidelines that are flipping the script on how we handle muscle pain. This slide lays it all out, nice and clear. The old way, you'd probably get a prescription for a pill, right? An oral NSAID, or maybe even an opioid. The new guideline says, hold on a minute. Now, the very first thing they recommend is topical NSAIDs. That's creams or gels you put right on the spot that hurts. It targets the pain without affecting your whole system. And they're also pushing non-drug options like acupressure and nerve stimulation. The whole idea is to get relief with way fewer risks. And look, you don't have to take my word for it. The president of the American College of Physicians, Dr. Jacqueline Fincher, said it perfectly. The evidence is clear. We have good, quality treatments that don't involve opioids. This is a huge statement and a direct push toward much safer pain management.
So to really get why this shift is happening, let's do a little case study. We're going to zoom in on one specific type of drug that used to be handed out all the time, a muscle relaxant. This is where you can really see the kind of hidden dangers that sparked these new guidelines.
Okay, so the drug we're looking at is called carisoprodol. You might know it by its brand name, Soma. It's meant for short-term relief of muscle pain. And I want you to remember that phrase, short-term. It's going to be really, really important in a minute. So this is what carisoprodol looks like on a chemical level. But don't worry, you don't need a chemistry degree for this. The real story isn't just about this one molecule. It's about what your body turns it into after you swallow it.
And here it is, the plot twist. When carisoprodol gets to your liver, your body breaks it down and converts it into a totally different chemical called meprobamate. So you might think you're taking one drug, but your body is actually making a second one on its own.
Now, here's the catch. That second chemical, meprobamate, it doesn't just work on your muscles. It actually has anti-anxiety and sedative effects, meaning it messes with your central nervous system. And that is what gives it a really high potential for abuse and for physical dependence. This is the risk that's been hiding in plain sight.
And that potential for dependence, well, it opens up a whole can of worms, especially if you use it for too long. When your body gets used to having the drug around, trying to stop it can set off a really nasty chain reaction we call withdrawal.
So, who's most at risk here? Well, it's especially high for anyone who takes the drug for more than the recommended 2 or 3 weeks. The risk is also a lot higher for people who have a history of substance abuse or are dealing with other mental health conditions.
And let me be clear, withdrawal isn't just feeling a bit crummy. The symptoms can be incredibly serious. In the short term, you're looking at things like anxiety, headaches, and even life-threatening problems like seizures. And long term, the consequences of being dependent can include liver damage and even respiratory depression, which means your breathing can slow down to dangerous levels.
Okay, this brings us to a super important public safety announcement. Because the withdrawal is so severe, how a person stops taking this medication is everything.
So what is the absolute worst, most dangerous thing you could possibly do? It's right there. going cold turkey, just stopping all at once. It sends your body into total shock because it doesn't have any time to adjust.
And we're not just talking about being uncomfortable. Suddenly stopping can trigger some truly terrifying symptoms: insomnia, tremors, hallucinations, and in the most extreme cases, something called psychosis, which is a complete break from reality. This is not a risk anyone should ever take on their own.
So what's the safe way out? It's a process called tapering, and it has to be supervised by a doctor. Step 1, and this is non-negotiable, is you talk to your doctor. They'll help you create a plan to slowly, gradually reduce your dose over time. This gives your body a chance to adapt while you both watch for any symptoms. And this is also the perfect time to bring in those safer alternatives, like the topical creams we talked about earlier.
So, after all of this, what's the big picture? What's the takeaway for you? Well, it really comes down to understanding that you have a huge role to play in your own healthcare. All right, let's recap the most important points. 1. How we treat pain has changed. Think topicals first, not pills. 2. Know the hidden risks of drugs like carisoprodol and how your body changes them. 3. These things are only for very short-term use, 2 to 3 weeks tops. 4, and this is the big one, never stop taking them on your own. And finally, number 5, talk to your doctor. Ask about these new guidelines.
Ultimately, it's about this: being an active participant in your own health. Knowing why you're being prescribed something is just as important as knowing what it is.
And so, I'll leave you with this question to think about. The next time you reach into that medicine cabinet for what seems like a simple fix, just pause and ask yourself, is this really just a short-term solution, or could it be a potential long-term problem?